Hello and welcome. Today we're going to discuss a challenging condition that can impact vision: toxic neuropathy affecting the eyes. We'll explore what it is, what causes it, how it's diagnosed, and what treatment options are available. Toxic neuropathy affecting the eyes arises when the optic nerve, which carries visual information from the eye to the brain, is damaged by exposure to certain toxins. A common culprit is exposure to medications, particularly chemotherapy drugs like cisplatin, ethambutol, or amiodarone. Other toxins, including certain heavy metals, alcohol, and even nutritional deficiencies, can also trigger this condition. It's crucial to identify the offending agent to address the problem effectively. At a cellular level, the toxic substances interfere with the normal functioning of the optic nerve fibers. This can involve disruption of mitochondrial function, which impairs the energy supply to the nerve cells. Demyelination, the breakdown of the protective myelin sheath around the nerve fibers, can also occur. These processes ultimately disrupt the transmission of visual signals, leading to a range of visual disturbances. The specific mechanisms can vary depending on the toxin involved, but the end result is damage to the optic nerve and impaired vision. The exact incidence of toxic neuropathy affecting the eyes is difficult to pinpoint, as it often goes underdiagnosed or is attributed to other causes of optic nerve damage. The risk depends heavily on exposure to the causative toxins. For example, patients undergoing chemotherapy with drugs known to be neurotoxic are at a higher risk. Likewise, individuals with chronic alcohol abuse or certain nutritional deficiencies also face an elevated risk. More studies are needed to accurately determine the prevalence of this condition in different populations. The signs and symptoms of toxic neuropathy affecting the eyes can vary in severity. A common initial symptom is a gradual, painless blurring of vision in both eyes. Patients may also experience a reduction in color vision, particularly difficulty distinguishing between shades of red and green. Visual field defects, such as blind spots or peripheral vision loss, can also occur. In some cases, patients may report eye pain, although this is less common than other symptoms. It's important to note that these symptoms can develop gradually over weeks or months, making early detection challenging. Diagnosing toxic neuropathy affecting the eyes involves a thorough ophthalmological examination. This includes assessing visual acuity, color vision, and visual fields. An examination of the optic nerve using an ophthalmoscope can reveal pallor or swelling, indicative of nerve damage. Imaging studies, such as MRI of the brain and orbits, may be performed to rule out other causes of optic nerve compression or inflammation. Blood tests can also help identify potential toxins or nutritional deficiencies. A detailed patient history, including medication use and exposure to other potential toxins, is crucial for establishing the diagnosis. While there isn't a formal classification system for toxic optic neuropathy, it can be categorized based on the causative agent. For example, we can talk about cisplatin-induced optic neuropathy or ethambutol-induced optic neuropathy. Additionally, the severity of the condition can be classified as mild, moderate, or severe based on the degree of visual impairment. The cornerstone of treatment for toxic neuropathy affecting the eyes is to immediately discontinue exposure to the offending toxin. This may involve stopping a specific medication or addressing a nutritional deficiency. Supportive care, such as nutritional supplementation, may be recommended to help the optic nerve recover. In some cases, corticosteroids may be used to reduce inflammation, although their efficacy is still debated. Vision rehabilitation may be helpful for patients who have experienced significant visual loss. It's important to work closely with your doctor to develop a personalized treatment plan. Preventing toxic neuropathy affecting the eyes involves minimizing exposure to known toxins. This includes careful monitoring of patients undergoing chemotherapy with neurotoxic drugs. Regular eye exams are recommended for those at risk. Individuals should also be educated about the potential visual side effects of certain medications and toxins. Maintaining a healthy lifestyle, including a balanced diet and avoiding excessive alcohol consumption, can also help reduce the risk. The prognosis for toxic neuropathy affecting the eyes varies depending on the severity of the damage and the promptness of treatment. In some cases, visual function can recover significantly after the toxin is removed. However, in others, the damage may be permanent, leading to long-term visual impairment. Recent research is focused on developing neuroprotective agents that can protect the optic nerve from damage caused by toxins. Studies are also investigating the use of stem cell therapy to regenerate damaged optic nerve fibers. While these are promising areas of research, more studies are needed to determine their effectiveness. Thank you for watching.